All right, the Prime Minister's speech there about little over 15 minutes, a message of reassurance that yes, we are in the second wave and we are tackling this second wave unitedly as a country. The big headline, no lockdown. He has emphatically said there will be no lockdown. We have to take care of the health of the economy as well as the health of our citizens as well. He's also said that lockdown should only be a last resort, a last option. Until then, there is only one mantra, dawai bhi or kadai bhi. He's also said that he will urge state governments too that have gone into lockdown to reconsider this decision of a lockdown, because the Prime Minister has made it absolutely clear there is no question of going into a lockdown. Yes, this second wave is tough. Yes, this second wave has come at us hard. And yes, whatever it takes, whether it is oxygen cylinders, whether it is drugs like remdesivir, or whether it is vaccines, the government will move resources on a war footing to ensure that no one is left behind. He's also mentioned and specifically spoken directly to the migrant workers, saying, please don't leave the cities where you're employed. Vaccines will reach you very soon. This, of course, on the back of the decision taken yesterday to make vaccines available to all above the age of 18. Appealing directly, the Prime Minister appealing directly to migrant workers, telling them, do not leave your cities. You do not have to rush back home. We do not need to repeat the scenes of last year, because the vaccine will reach you very soon indeed. The big takeaway, no lockdown. Emphatically, the Prime Minister has said, in fact, going to the extent of saying that lockdown has to be necessarily the very last option. Maria Shakil, our political editor, joining us. Maria, so the big takeaway, no lockdown, but also a message of reassurance from the Prime Minister that as bad as this second wave is, we are still fully equipped to deal with it.
Yes, that's right. And the pharma companies, the vaccine manufacturers are all fully equipped. They are ensuring that even the oxygen supply is being scaled up for meeting the requirements there. And he has particularly called upon the youth of Dhaka to rise to the occasion and ensure lockdown partial lockdown and certain should be implemented in letter and spirit. But he also told the states that
this should be seen as last resort, that locking down of parts or of certain containment zones should be seen as last resort. There should be other strategies that should be in place. And at the same time, I think the assurance that he gave to the migrant laborers is very, very important, because increasingly those visuals had started coming in of certain railway stations where migrants had started leaving the cities, the big metros, for their respective native homes. The Prime Minister assured them, saying that in the next few days vaccine will be provided for free. He said, for the poor of the country, vaccine will be provided for free. They should be prepared for it. And at the same time, because there will be no lockdown, the issues of livelihood will be taken care of as well. So two message, as you pointed out rightly, no lockdown, and at the same time, a very worrying nation which is seeing gloom and doom, a message of reassurance coming from the top leader of the country, that is the Prime Minister.
In fact, he also mentioned that, in amidst all of this gloom and doom, there are so many positive stories of people, ordinary people, going out of their way to help others, whether it is procuring remdesivir, whether it is finding a hospital bed, whether it is oxygen cylinders. He's also asked the media to highlight those stories. Let me also go across to Payal Mehta. Again, the big takeaway, Payal, from the Prime Minister's speech, a little over 19 minutes long, the Prime Minister's speech, very short one, but the big takeaway, no lockdown. The lockdown should be absolutely the last resort. He, in fact, even said he will urge those states which have already gone into some form of lockdown to reconsider that decision, because 2021, we are far better equipped to deal with corona, far better equipped to deal with this second wave than we were same time last year. Payal.
Yes, so Zaka, it's going to be very, very assuring as far as people of this country are concerned, because remember, there was some sort of a panic which is set in, thinking that, possibly a lockdown could really happen. But the Prime Minister urging the states that have also announced some form of a lockdown to actually reconsider that decision. He makes it very, very clear that jahan bhi hai or jahan bhi hai, because obviously the economy cannot be left to rot, given the fact that we've seen the bad impacts of the lockdown, for which we had no option last time around, and we've seen the impact that it has had on the economy. Having said that, the Prime Minister once again telling people that you should not let your guard down. We fought this in the past, and there's no reason why we can't fight this again. And obviously, Zaka, like you rightly mentioned, that the kind of help that people have extended to each other, irrespective of whichever party you're coming from or irrespective of whichever background you're coming from, the smallest of help to the biggest of help, everybody coming in together as well. It's so encouraging to see this on social media day in and day out, where people across political party lines are helping each other out. So obviously the cause of humanity taking the biggest lead over here, and the Prime Minister also urging people, across the societies, etc., to form small committees to try and see what help can be really extended. He also reached out to every section of society, including children, saying that make sure that you create such an atmosphere at home
Yeah.
that nobody wants to really go out and leave their home, but be in this together as well. So the nation getting a very, very assuring, words coming in from the top leader of the country, the Prime Minister addressing the nation and telling them that yes,
All
we are
right.
much better equipped this time around and we can fight this together.
Okay, I'm going to thank both Payal and Maria for joining us. Again, the big takeaway, like we said, lockdown should be a last resort. Those are the words of the Prime Minister, a reassuring message that we are in a much better position today in 2021 to deal with this second wave in terms of hospital infrastructure, in terms of oxygen, in terms of ICU beds, in terms of remdesivir and other drugs that are required, and most importantly, vaccinations. Already more than 12 crore, almost 13 crore people have been vaccinated, and the Prime Minister has sent out this message of reassurance that there is no need to flee from cities back to hometowns, no need to repeat the scenes of 2020 where thousands of migrant workers fled from big cities like Mumbai and Delhi back to their hometowns because of the short notice lockdown. This time the Prime Minister making it absolutely clear, absolutely no need for a lockdown at this stage. In fact, a lockdown should be a last resort. Dr. Shashank Joshi is member of the Maharashtra COVID Task Force. Incidentally, we're also getting reports, Dr. Joshi, and I wonder, your thoughts about this. Maharashtra is already in some form of a Janta curfew. There are reports that tomorrow the Chief Minister there will be addressing citizens and announcing further restrictions and further tightening. Delhi, where I am, is already in a week-long lockdown situation. And the Prime Minister coming out and saying that lockdown right now is not necessary. Definitely a national lockdown is not necessary. And he's also said that even to those states that have put in these restrictions, he would appeal that lockdown should be a measure of last resort. Medically speaking, where do doctors like you stand on this? I know it's one thing to get you some kind of a buffer time period of 10 days or 15 days to build up medical infrastructure, but we've had a buffer of over a year. Does the lockdown, given its cost-benefit analysis, does the lockdown still serve the same purpose it served 1 year ago?
No, Zaka. I think it's very clear that the purpose of lockdown is to build healthcare infrastructure. And unless and until a tsunami-like wave overwhelms the healthcare infrastructure completely, there is no need. You can have restrictions in place, you can have containment in place, and that should suffice. For example, in Mumbai, right now we are seeing a plateauing effect. We have enough infrastructure and the enough beds as long as they are on the dashboard, and the healthcare infrastructure is not strained beyond reason, and the rate of growth can be stemmed out. We don't think that we need to go for a total lockdown. We completely agree with the Honorable Prime Minister that currently, unless and until there is an absolute last resort, where a tsunami-like wave hits a particular geography, where the healthcare infrastructure is completely overwhelmed, then only probably as a last resort, a lockdown should be resorted. He has given a very positive signal, a very reassuring signal, but he has also subtly said that we need to adhere to COVID appropriate
Yes,
protocols. Whether
absolutely.
it is the COVID appropriate behavior or whether it's adhering to protocols, that is mandatory. There is zero tolerance for that. And he's also tried to say that there is no need to panic. Even if you are having COVID, 80% will be asymptomatic. They will, this time, the wave may be very fast, but the recovery is equally fast and there's a low case fatality rate. Only thing is we are stumped by the sheer number of cases which have overwhelmed us.
Okay.
That is the challenge.
Two things that have stood out in terms of people's troubles, as it were, this time around as opposed to last time. One, oxygen. I think in Mumbai, in Delhi, across big cities, oxygen is turning out to be a bit of a concern. There's a scramble going on for oxygen. And two, drugs like remdesivir. Could you tell our viewers, where do we stand, at least in a city like Mumbai where you are, where do we stand on both of those counts?
So I think oxygen was a genuine concern and oxygen was in short supply. But I think to a great extent, the government of Maharashtra and Bombay Municipal Corporation has worked overtime so that all the oxygen shortages have been restored and a rationalization and oxygen audit has happened. so that there is no wastage of oxygen also. And innovative methods like trapping atmospheric oxygen, etc. And a lot of help also from the corporate world as well as government of India is bailing us out of the oxygen crisis. As far as drugs like remdesivir is concerned, all of us are very clear it is not a life-saving drug. It clearly improves recovery by a couple of days, hospital stay by a couple of days, but it is not at all a life-saving drug. It doesn't lower mortality. It is an experimental drug. There is no need to panic. But yes, there is genuine shortages of other drugs
Okay.
beyond steroids and oxygen, like tocilizumab, itolizumab, and even remdesivir. And that also, I think, will be there. Bombay Municipal Corporation has sufficient stock of remdesivir in the government sector. But this time, unfortunately, the pandemic has hit us in a better socio-economic, gradient, and that is why there has been a lot of hardship, particularly
True.
in the private sector,
True.
and that is where the challenge lies in Mumbai. And I'm told Delhi is particularly hit, so it has to be a local decision. And I think the Prime Minister has empowered the local geographies and local state governments to take their respective decisions so that they can do the best for their citizens at large.
Okay, let me go across to the political spokespersons as well. Gopal Krishna Agarwal, national spokesperson of the BJP, and Dr. Ajay Kumar is a spokesperson of the Congress Party. Mr. Agarwal, we're also welcoming in the chairman and GMD of Columbia Asia Hospitals, Dr. Nandkumar Jairam. I'll start with Gopal Krishna Agarwal, though. The Prime Minister emphatically saying, not once, but at least on 2 or 3 occasions in that short speech of his, there's going to be no lockdown. In fact, he said the lockdown should be a measure of last resort. He, in fact, also said that he'll speak to state governments that are seeing some restrictions, like Delhi, for example, or Maharashtra, another example. He'll speak to state governments to use lockdowns only as a measure of last resort. At a time when, the 2 biggest cities are under lockdown, how does one square what the Prime Minister has said to the nation just now and what is actually happening in some of these big states and cities?
Zakat, I think the Prime Minister today very categorically said in whatever message he could give is that these 2 states, the Maharashtra and Delhi, where lockdown is announced and the way migration labors are running, that creates a lot of panic. So at this stage, the crisis, everybody agrees that there is a crisis. The second wave is severe and it is a complicated manner. It has risen, but we are well equipped to deal with it. We have sufficiently knowledge about the virus. We have sufficient good pharma infrastructure that the Prime Minister also said. Vaccine is also there, 2 already there, more are coming. And today, Piyush Goyal also came out with a statement that more than 4 times we have increased the production of
Oxygen.
oxygen.
Yeah.
So the things is that remdesivir is also being produced. Private sectors are helping. Pharma industry is there. So there is no need to create panic and complicate the matter. The way migration labor suffers with this rush, and the Piyush Goyal also had to come out with statement that railway will not be stopped. So these kind of rumor mongering and the statement like I would surely mention here Arvind Kejriwal saying that that situation is not in my control. These kind of things create a lot of panic. You have understand, everybody knows the problem. We have to deal together. We are much equipped, better equipped, and the Prime Minister himself is taking stock. But the state government have to be more vigilant and not fuel such kind
Okay.
of
Let me ask,
situation.
let me
The
ask
last
Dr. Ajay Kumar, because you're also a doctor, first before you became a political spokesperson. The point is the Prime Minister sending out a message of reassurance. We do not have to live through 2020 all over again. He specifically appealed to the migrants saying vaccines are reaching you. You don't need to leave the cities that you're working in and rush back home. It doesn't have to be deja vu. He's also said that I will appeal to state governments who have locked down to reconsider those decisions because the lockdown should be a measure of last resort. Why then are state governments, particularly opposition ruled states, Dr. Ajay Kumar, insistent that lockdown is the only way to solve this problem?
Look, Zaka, what's interesting is I think the chief ministers of the various states in India also heard for the first time the Prime Minister saying that lockdown is not a solution. So now, if this is the level of how India is functioning, where there is chief ministers meetings happen, there is no discussion on this issue, and I think they are also taken by surprise where the Prime Minister announces it to rest of us in a one-way communication. And even the Chief Ministers get to know it, because if they had known it, if this discussion doesn't happen, whether it is Jharkhand, whether it is other places, then I'm sure situations in Gujarat and other states and Uttar Pradesh and all are very grim, and that's a different, for a different discussion. The fact is that across the different parts of the world, when you talk to experts, when you talk to the health experts, when you talk to the, whether it's the British or the European Union nations, they have resorted to different kinds of lockdown at different periods of time. This government has got believes, don't want to believe Harvard people and wants to rhetorically said that hard work is more important than Harvard. But I think in this case, Harvard and other institutions like even the Public Health Foundation of India will be very important. So I want to, Zaka, I kept hearing nothing to panic. There is everything to panic. I've been a member of parliament from Jamshedpur. I mean, there is panic everywhere in Delhi, Jamshedpur, Ranchi. Every part of this country is panicking.
No, but Dr. Kumar, I mean, surely you don't expect the Prime Minister, when he's addressing the nation, to also share in that panic. His job is to reassure citizens and make them not panic. That's what he has done.
Okay, first,
Government chief ministers to do their duty and not create
Can
panic.
I complete, sir? Can I complete?
Yeah, sure.
Sure. So what was the job of the Prime Minister? Today the states are responsible. What is the job of the government of India? Remdesivir, they made it centralized, unavailable. They made toxicillomab, not available. Oxygen, not available. 50,000 ventilators, not available. Vaccines, not available. I mean, high time you guys ask Prime Minister, what is this, and this government of India, what is their accountability? How many people are dying? You tell me 260,000 people coming in, and that is reporting by a factor of 3 to 5 what average people are saying. If you look at the lines, tokens are being given to the crematoriums. There is no places left. And the death figures, everybody across the world, people are saying we are underreporting the death figures by a factor of 3 to 4.
Okay.
But let's imagine that this.
Gopal Agarwal respond. Yeah, respond to that, and then I'll go to Dr. Jairam after this. But I don't agree with what Dr. Kumar has said, that there's panic on the streets and therefore we need to reflect that panic. I don't think that's going to help anybody's cause. In fact, when the leader of the nation speaks, you expect him to reassure folks. You expect him to calm nerves. Okay, Gopal Agarwal, respond.
Yeah, Zaka, I won't like to mention 2-3
No,
things.
basically, he's asking you a very pointed question. He's asking that you guys, from top down, you come on TV and you say everything is fine, everything is hunky-dory. But he is saying, Dr. Kumar, that on the ground the situation is different. It is one of panic.
No, I think I would like to mention here is many things Dr. Ajay Kumar said about oxygen, remdesivir, about the vaccination. All these things have been many times clarified by the health minister, other people. Oxygen is not a central subject. Though central government has allowed import of 50,000 liters of oxygen. So why the state governments are not prepared? Health infrastructure is not a central subject. Why Maharashtra and Delhi have faltered? So that is the question. Even if BJP ruled state has faltered, they will also be questioned. But you cannot put every problems and putting it the blame on the central government. Remdesivir, the requirement, nobody could expect that sudden. And this, I will surely tell you, the demand for remdesivir is not actual. It is a panic demand. Because of panic, people are. Who is going to take remdesivir in his home? It is clearly said by the expert doctors that it is not to be taken in home. So why everybody is rushing?
Yeah, no, that's a fair point. Remdesivir, first of all, is not a silver bullet. Second of all, you cannot take it at home. So it's inexplicable why there are these lines. But I want to go to Dr. Jairam. One second, I want to go to Dr. Jairam. Again, what we are having is a fascinating sort of dichotomy, if you will. On the one hand, and absolutely, the Prime Minister is right. Lockdowns cannot be a solution. Lockdowns should be, a last resort. Yet at the same time, Dr. Jairam, what we are seeing, evidence on the ground, state after state, and not just necessarily, opposition ruled states. Maharashtra, yes. Delhi, yes. But even where you are in Bangalore, Karnataka had a meeting today, and over the last few days, the Chief Minister has been meeting. Looks like Karnataka will also implement some form of restrictions going forward. Medically speaking, though, is there any other good reason other than to ramp up health infrastructure, which may be deficient at one point of time, to ramp up that health infrastructure? Other than that, medically speaking, do lockdowns help?
Well, I would say that it only helps to contain it for a while. You can't be locked down forever in your life.
Yeah.
At some point in time, you have to open up. And when you open up, you expose yourself once more. I think the basic point is being forgotten by everyone here. And that is the three cardinal principles with which we can fight this virus stronger and better than anything else: social distancing, masking, hand washing. Now, it's unfortunate that the people of this country do not, and I repeat, do not understand the importance and value of this, from the very educated to the very uneducated. And that singular fact is largely responsible for perpetuating and causing the waves that we have seen right now.
No, but why has that
Yes.
happened? Is it because at some point, the numbers came so low that people said, okay, that's it, we're done, we've overcome corona, and therefore they forgot about COVID appropriate behavior? Because what is surprising to me is this time, and there's evidence for this in Mumbai, in Delhi, and I'm sure in Bangalore as well, a bulk of the cases, a majority of the cases are happening in middle class societies. And these are
Yes.
people who know the importance of washing hands and sanitizing and social distancing and wearing masks. So where did it go wrong then?
Well, Zaka, I would agree with you that people did become lax as the numbers came down. But let me say that there have been people, and educated middle class people, who still flaunt themselves even today in the park while walking with the masks improperly or not used at all.
Yeah.
Where is the social commitment that this nation has shown or has fought hand in hand with the government in this war? I fail to see why the blame is always put on the government, whatever government that may be, and not introspect to say, what have I done wrong? There's a lot that we have done wrong.
Okay.
How many of us have not really flaunted the three cardinal principles at some point in the last 3 months? Let's place our hands on our chest and say, I have not done so. You'll find very few.
Yeah. Okay. Let me go back to Dr. Joshi. And again, I come back to this point. The second wave, like you said, maybe it's coming at us fast, much faster than we expected. But it's also less fatal. It's also less harmful in that sense. And yet, though, Dr. Joshi, even though more than 80% of the cases are asymptomatic, why are we seeing these anecdotal stories about hospital beds being full, about oxygen not being available? Is it because the sheer numbers itself in a country of our size is huge to deal with, even though the really badly infected patients may be still less than 20% of the overall number who are testing positive?
So, Zaka, there are two reasons for this. Number one is the rate of spread is definitely fast. So the sheer numbers have overwhelmed. But the second thing is a lot of asymptomatics are occupying hospital beds, which creates an artificial shortage. We have to have a zero tolerance and not use influence for people who are asymptomatic or mildly symptomatic. They can stay in a non-hospital like setup, even if they don't have facilities to stay at home, and they need not go to the best of private hospitals. Even if they go to public hospitals, or the care will still be the same. Corona care is
Is
all
it
about
not
supportive
possible
care.
for hospitals to refuse mildly symptomatic or asymptomatic patients?
So that is what we have appealed yesterday when we had a dialogue with the Prime Minister, that there should be a zero tolerance. Most deserving patients should only get in. There should not be any influence whatsoever. It should be strictly merit-based criteria on the medical merit of the patient. Who are moderate to severe cases, only they who merit admission and are worthy of admission should be admitted, so that the precious hospital bed is conserved. That is number one. Number two, yes, there has been an overwhelming of facilities, but there are enough public health facilities which are still vacant in various geographies. So I think it is important for people also that the treatment will remain the same, and this is a time of crisis. I agree with my other panelists that it is a question of self-regulation and it's a behavioral issue. and that for that you have to be responsible. Each human being has to take some responsibility. We can't shirk responsibility that we are fatigued, we are tired, we are rebellious, we are revengeful. It is time for us to wake up and follow it from ourselves
Yeah.
and lead by example. And I think I'm very happy that the Prime Minister has assured all of us. He has been very, very positive. Despite of the panic prevailing, he's tried to dispel the panic, stating that we have to be careful and we have to be cautious. He's fully mindful of the grim situation and the grim realities. But at the same time, he's fully mindful that the economic engine has to continue
Yeah.
at a very correct way without losing lives. He also made a very clear remark that lives have to be saved at any cost. And that is something which is most crucial.
Okay, I want to go back to both Gopal Agarwal as well as to Dr. Ajay Kumar. Gopal Krishna Agarwal, again, the Prime Minister directly appealing to the migrants. One of the heart-wrenching scenes that we saw last time, today the Prime Minister directly appealing to them, saying that this is not 2020, vaccines are going to be there, we've opened it up to 18 plus for all adults in the country, so please stay where you are. And yet, at least in the last couple of days, certainly in Delhi and for a few more days in Mumbai, we are seeing streams of migrant workers going back to their hometowns. Why is that?
Zaka, I would just like to take talk 2 3 points. One thing I agree with the doctor that this is being a student of economics. I also know this is a behavioral problem that has seeped it into the crisis. There is a crisis. I agree. There are certain problems, but the panic that is being created is a behavioral problem because many people who don't even need, they are rushing after remdesivir, they are running after hospital admissions, and that is creating more problem. Now this lockdown, which also being an economic student, I understand that this, we don't need lockdown because it will hurt the weaker section most, and economy which has been on back cycle of recovery will be hurt, and it will be a wrong long term difficult for those very people for whom our government works for the poor sections and the lower strata of the population. The third thing I would just like, I'm living in Noida. One thing I tell you today, many calls came that private vaccine labs are not testing and they are not collecting sample. I asked many of the lab, they said the government has instructed. I asked the DM of Noida, he said I have not instructed, given any such instruction for private lab to not test. Who is fueling this kind of rumors? I would like to put on record here that this panic is systematically created by some of the straw people in high power in the oppositions and in the social media, which are creating panic. Why these kind of decisions are taking? Why Maharashtra government went and arrested the people in pharmaceutical companies? So these kind, they are trying to create panic. Again, Rahul Gandhi today, what his statement is that Manmohan Singh 2 days back said we should open up, make it transparent, open supply of pharmacy. I agree with many of the Manmohan Singh suggestions, but the government did those announcements yesterday, and now Rahul Gandhi is saying why this is a private people's and government is working for the private people. It is looking after this benefits and profits.
Okay.
Is this the
Okay, Ajay
position
Kumar,
that should
respond to that. Again, the point that Mr. Gandhi made, make vaccines free. Surely vaccines can't be free. Even now, it's only for people who can't afford it, 50% that it is free. The rest of it, the rest of them are paying a certain fee, 250 rupees per dose. Eventually, when it comes to market, the market will decide what the price is going to be. But be that as it may, this panic that
no,
we are seeing, this panic that we are seeing, Dr. Kumar, how much of it is actually there on the ground and how much of it is actually a social media creation?
So, with all due respects to the other doctors of the panel, when you and I want to explain answer. So, give me a couple of minutes. If the social distancing is so critically delayed on the people of India, and Kumbh Mela and the Bengal elections are fine, and there is no comment by the ruling party. So when as doctors and professionals we come on TV channel, I would require that once can I complete, sir? Can I complete? After 31 lakhs people continuously went into the Kumbh Mela, there was not a single comment, and then we made communalized experience. The second point, somebody said, one of the doctors said was lockdowns are a temporary solution. Yes. When the Prime Minister announced a 4-month lockdown, and at at that time we didn't prepare. Third, the oxygen facilities to be made in the district hospitals through the Prime Minister Care Fund. The tender was released after 8 months in October 2020, and only 5 hospitals out of 150 have it. But no, we have prepared oxygen. It's a state subject. Remdesivir was being controlled. The production and manufacturing was being controlled by the government of India, and that is why there is a shortage, not market forces, sir. There was no production of remdesivir, there was no stock of remdesivir production, and please check the facts. The third point, that vaccine at 18 plus everywhere in the world, European Union is giving it, say, are you going to let the poor people of India die? Suppose market forces say that it is 5,000 rupees per...
Sir, but only 50%, sir, only 50% is going to be made available either to states or to market. Remaining 50%, remaining 50% will be procured by the central government, who presumably will give it to the poor people free of cost.
Please, one second. Please indulge me for a second.
Okay.
What I'm trying to say is, the government is saying 80, the rest the states have to negotiate. So when we are sitting on this panel, we can't speak in folk tongues. We say that Kumbh Mela, there was no statement, but public should put masks. We say that elections will carry on, but should wear masks. No, and that oxygen was the government of India's responsibility. Where is the 50,000 ventilators? Will the doctors on the panel ask the Prime Minister? As a doctor, I want to ask the Prime Minister, where are 50,000 ventilators? But the problem is, when we as professionals don't ask the government questions, forget Congress or BJP, ask the Maharashtra government, please. Ask the government in Jharkhand. But stop mollycoddling failure, sir.
All right, we'll leave it at that. We'll see. Like we've been saying over the last few days, the situation on the ground needs to be dealt with. The second wave is here, and we need to fight this on a war footing. And it can only happen if all of us are on the same page, irrespective of political party differences, irrespective of central government versus state government, irrespective of BJP versus Congress. Everybody needs to be on the same page and put their best foot forward. Because if we don't do it now, and Dr. V.K. Paul of the Niti Aayog said this, if we can't come together as one in the next 3 weeks, then we will have hell to pay for. I'm going to thank all our guests. We'll take a quick break. When we come back, we'll play out some excerpts of the Prime Minister's speech a short while ago to the nation, reassuring the country that whatever needs to be done will be done in this fight against corona. Welcome back to Brass Tacks. The Prime Minister addressing the nation a short while ago, categorically ruling out the possibility of a lockdown. In fact, going to the extent of saying that a lockdown should be a measure of last resort, and that he will speak to states that have imposed some form of restrictions like Delhi, Maharashtra, etc., to reconsider putting lockdowns. Let's listen in to what the Prime Minister said.
साथियों, आज की स्थिति में हमें देश को लॉकडाउन से बचाना है। मैं राज्यों से भी अनुरोध करूंगा कि वो लॉकडाउन को अंतिम विकल्प के रूप में ही इस्तेमाल करें। लॉकडाउन से बचने की भरपूर कोशिश करनी है और माइक्रो कंटेनमेंट जोन पर ही ध्यान केंद्रित करना है। हम अपनी अर्थव्यवस्था की सेहत भी सुधारेंगे और देशवासियों की सेहत का भी ध्यान रखेंगे। साथियों, आज नवरात्रि का आखिरी दिन है। कल रामनवमी है और मर्यादा पुरुषोत्तम श्री राम का हम सभी को यही संदेश है कि हम मर्यादाओं का पालन करें। कोरोना के इस संकट काल में कोरोना के बचने के जो भी उपाय है, कृपया करके उनका पालन 100% करिए। दवाई भी, कड़ाई भी, इस मंत्र को कभी भी भूलना नहीं है। ये मंत्र जरूरी है, वैक्सीन के बाद भी जरूरी है। रमजान के पवित्र महीने का भी आज 7वां दिन है। रमजान हमें धैर्य, आत्मसंयम और अनुशासन की सीख देता है। कोरोना के खिलाफ जंग जीतने के लिए अनुशासन भी उसकी भी उतनी ही जरूरत है। जब जरूरी हो तभी बाहर निकले, कोविड अनुशासन का पूरा पालन करें।
All right, Maria Shakil, our political editor, joining us. The Prime Minister also invoking both Ram Navami and Ramzan to send home the message that we have to follow COVID-appropriate behavior.
Yes, that's right, Zaka. And as you have been mentioning, that what has to be followed is the norms and the rules that have been done by most Indians, although the fatigue that has set in has led to this surge in the second wave. But the Prime Minister also sending a message to the various states that lockdown or night curfew or these strategies should be the last resort. And this, of course, is coming at a time when news is coming in, Zaka, of Maharashtra looking at going for a total lockdown, which could be announced in the next 24 hours. So the issue is of livelihood as far as lives and livelihood going simultaneously is concerned. The Prime Minister also assuring the migrant laborers and those who are poorest of the poor, telling them that they have to stay put where they are because vaccine will be provided to them free of cost, and at the same time their issues of livelihood will also be continued to be addressed because he is not looking at a total lockdown or a complete lockdown. I think that is also coming in the backdrop of all the images that had started emerging from several railway stations of migrants going back to their native places, which was a matter of concern because, we have seen in this particular second wave, Zaka, there are no urban or rural centers per se. The spread of the virus is far and wide. Just about every village perhaps in India has some degree of infection now.
All right, Maria, we'll leave it at that. The Prime Minister emphatically saying that there should not be lockdowns. In fact, lockdown se hame bachna hai. Lockdown should be a last resort. Also saying that he will speak to state governments, urging them not to impose these lockdowns. We'll see how that progresses further. But right now, the message has to be in unison. We have to fight this together as one country, one nation, one people. A big salute to not just the doctors and nurses and medical staff who are out there who are battling and toggling 24/7 saving lives, but also to ordinary heroes who have gone beyond what is asked of them, beyond their ordinary lives, gone out and extended a hand of help to completely and random strangers who have been in need of that help. So a salute to all of those folks. We'll take a quick break. Final segment, we'll have excerpts from the Prime Minister's speech.
हमारे वैज्ञानिकों ने दिन रात एक करके बहुत कम समय में देशवासियों के लिए वैक्सीन विकसित की है। आज दुनिया की सबसे सस्ती वैक्सीन भारत में है। भारत की कोल्ड चेन व्यवस्था के अनुकूल वैक्सीन हमारे पास है। इस प्रयास में हमारे प्राइवेट सेक्टर ने इनोवेशन और एंटरप्राइज की भावना का बेहतरीन प्रदर्शन किया है। वैक्सीन्स की अप्रूवल्स और रेगुलेटरी प्रोसेसेस को फास्ट ट्रैक पर रखने के साथ ही सभी साइंटिफिक और रेगुलेटरी मदद को बढ़ाया गया है। यह एक टीम एफर्ट है जिसके कारण हमारा भारत 2 मेड इन इंडिया वैक्सीन के साथ दुनिया का सबसे बड़ा टीकाकरण अभियान शुरू कर पाया। टीकाकरण के पहले चरण से ही गति के साथ ही इस बात पर जोर दिया गया कि ज्यादा से ज्यादा क्षेत्रों तक, जरूरतमंद लोगों तक वैक्सीन पहुंचे। दुनिया में सबसे तेजी से भारत में पहले 10 करोड़, फिर 11 करोड़ और अब 12 करोड़ वैक्सीन डोज दिए गए हैं। आज कोरोना से इस लड़ाई में हमें हौसला मिलता है कि हमारे हेल्थ केयर वर्कर्स, फ्रंटलाइन कोरोना वॉरियर्स और सीनियर सिटीजन्स के एक बड़े हिस्से को वैक्सीन का लाभ मिल चुका है। साथियों, कल ही वैक्सीन को लेकर हुए एक और अहम फैसला भी हमने किया है। 1 मई के बाद से 18 वर्ष की ऊपर के किसी भी व्यक्ति को वैक्सीनेट किया जा सकेगा। अब भारत में जो वैक्सीन बनेगी उसका आधा हिस्सा सीधे राज्यों और अस्पतालों को भी मिलेगा। इस बीच गरीबों, बुजुर्गों, निम्न मध्यम वर्ग के लोग 45 वर्ष की आयु के ऊपर के व्यक्तियों के लिए केंद्र सरकार का जो वैक्सीन कार्यक्रम चल रहा है वो भी उतनी ही तेजी से जारी रहेगा।